Hello, my name is Sully Rodriguez. I am currently a sophomore at the University of Appalachian State, North Carolina, majoring in the athletic training program. Today I will be talking about a new anterior cruciate ligament tear reconstruction which involves the silk collagen scaffold. But first off, I would like to describe in short what exactly an ACL tear is and why surgery is needed for such an injury. The cruciate ligament is found in the knee and is present in two forms, the anterior and posterior ligaments, meaning on the front plane and towards the back of the knee respectively. The cruciate ligament are vital in stabilizing the knee during posture as well as movement. The anterior cruciate ligament specifically prevents the knee from twisting beyond its normal limits. It also carries the task of holding the tibia in place with the femur and preventing it from going too far forward. While these specific ligaments are designed to help stabilize the knee, sport and competition still take a toll on the human body. Weak muscles, awkward motions, or abrupt force may still be problematic and can lead to a partial or complete tear of a ligament. The most common of the two ligaments to tear is in fact the anterior cruciate ligament, with an estimated 200,000 cases occurring annually in the U.S. alone in collegiate sports, according to studies done at the Brown University. To give a better idea of what these mechanisms might be like, here are some videos of 3 different circumstances. Our first example is an adult male gymnast in a floor competition. Take a look. With the case of the gymnast, you can clearly see the anterior force, the tibia coming forward, and the valgus or inward stress on the knee. This is very common of what is known as the O'Donoghue triad. This is an injury where one action causes the medial collateral, anterior cruciate, and medial meniscus to all tear at once. This is not uncommon with ACL injuries, but is not always detected with immediate examination, and sometimes isn't discovered until the surgery itself. Up next is an adult male professional ultimate frisbee player towards the very beginning of a game. Take a look.
I didn't even drink.
Loose with the disc could be good. Yep. Nice. Put to Brody.
I think it's a big foot block.
That was a moderately sized.
The moderately sized.
Injuries don't always necessarily happen in one singular event. An injury can always be the progression of multiple impacts to the body part. In the case of the ultimate frisbee player, Brody Smith, there was an initial landing in which the athlete fell in a position that loaded the anterior and middle portion of the knee in a twisted position. While the player seemed to have walked away unaffected, he later was brought down after a series of steps, followed by a rather simple cut attempt. This was the last amount of force necessary to cause a tear to the ligament, rendering the knee unable to withstand weight and force. Our last example is an adult NBA professional basketball player attempting a layup shot.
Look, we're looking to sweep you guys. You wanted us. You were crying out that you bypassed the harder team in Miami Heat.
Rose came down bad on his left foot. See him holding onto his knee and down.
See in the game.
Let's see how he comes down on the left leg. Keep an eye on the left leg. There. Yep. When he planted, that's when whatever happened. Let's see here.
Yeah, it's before he comes down. It's the plant right there on that left leg.
There was some give on that knee, and you could see it.
Looked like it went in, too.
That's what I'm saying.
As a sport, basketball demands rigorous, short, and forceful bursts from its players in every kind of direction possible. With games happening multiple times a week on top of training, the body can be susceptible to overuse injuries. These are basically a result of weakened areas of the body becoming injured after repetitive use. As we can see, this basketball player makes an attempt at a jump shot and decides last minute to pass the ball. Afterwards, we can see him land forcefully on his left knee with a recognizable inward force with slight rotation of the leg. The position followed by strong compression can cause the ligaments to be pushed to its limits and possibly tear. The good news is that ACL tears in competitive collegiate sports result in surgical reconstruction from 90 to 100% of the time. The most common ACL surgeries deal with tendon grafts. With this type of surgery, a piece of patellar tendon of the same patient is taken in order to make a bridge between the two portions of the torn ligament. This surgery takes about 6 to 9 months for full to close recovery. Other autografts are also possible, such as hamstrings, semitendinous, gracilis, as well as Achilles tendons. In some cases, however, it is not always possible to extract enough material for the same patient for the procedure, thus creating the need for a donor tendon. This causes issues due to the fact that the biological compatibility isn't always guaranteed. The solution to this issue? Silk collagen scaffold reconstruction. Pause. Over time, silk and collagen materials had been considered for ACL repair, due to traits such as having the ability to be biodegradable, influence cell activity, and as well as its ability to be biocompatible. The only issue seemed to be its strength and durability. Zhejiang Cathaya International made it their job to investigate and test new silk collagen scaffolds, enhanced with new stitching designs such as pattern stitching and the addition of sericin, which acts like glue, and other chemicals to enhance strength of the material post-surgery. The new silk collagen material was tested on 40 male New Zealand rabbits alongside a control group using the basic autograft technique. Let it be noted that measures were taken with the Animal Care Committee of the University of Zhejiang before beginning the experiments. Here is an animated video that demonstrates the basic procedure that is carried out using these new materials, and the same one that the company tested on this select group of rabbits using the scaffold material. The video shows that, rather than forcing the tendon to comply with previously extracted tissue, the scaffold acts as a sort of pathway that encourages the two sections of tendon to reconnect to one another, thus allowing the tendons to essentially heal themselves rather than adapt to excess material. In the test dealing with the male rabbits, the corporation used range of motion, locomotive motion, and special ligamentous testing in order to evaluate the success and efficiency of the surgery after 2 to 3 weeks. In comparison to the autograft, there was greater visible range of motion with the rabbits that underwent the scaffold surgery. In respect to all other physical and mechanical tests, neither surgery showed to be different from the other. One great difference between the two surgeries was the visible amount of fibrous tissue growth into each graft. The autograft had no visible growth after 16 weeks post-operation. The silk collagen surgery, however, was proven to have significant tissue growth within the graft, proving the compatibility and compliance of the material within the rabbit's tendons. This video defends the purpose of the new silk collagen ACL reconstruction surgery. Enough information is out to allow for people to start testing ACL surgeries on actual patients in collegiate and even professional sports. Hopefully, later in the future, we will see silk collagen materials being used to help the reconstruction period be faster, more durable, and for the rehabilitation period to be quicker and allow athletes to get on the field sooner. Thank you very much for your time.